Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina at Hickory Spine. And today I want to talk to you about home therapies, things you might want to consider doing at home for arthritis. Now, most of the time when you have an inflammatory problem, let's say that you have an inflamed joint or you have you have pain in your spine. Let's stay with the spine first. You have pain in your spine due to an arthritic condition that's causing inflammation and irritating the tissues. One of the best therapies that I've seen, and in similar cases that we have used and recommended to people to do at home is to use heat. Now, a lot of people are, they wonder, do I use heat or do I use ice? And there are different times, different applications for both. But heat, and especially with arthritis, which tends to be a condition that has occurred over time, right? It's not something that just happens where it's not like you injured yourself lifting or something. This is something that occurs. It's a chronic or more long-term problem that happens over time. One of the most beneficial things is heat. And the reason that heat's beneficial is because it brings more circulation to the area, more blood flow to the area. It helps to loosen muscles, and it can really help to alleviate some of the pain of a chronic inflammatory condition, and in particular something like a chronic arthritic condition of the spine. Now, it's important to understand that sometimes ice is appropriate, but most of the time what we want to do is in a chronic degenerative type of condition, spinal arthritis, we can use heat and apply it directly to the spine, obviously wrapped in a towel. You do not want to burn yourself. You want to make sure that you're using temperatures that are safe and appropriate, and place it directly on the spine for 10 or 15 minutes. Now, something that can be really beneficial and it might help you out quite a bit is to alternate heat and ice. Now, I like this approach if it's a degenerative arthritic condition, like you have degenerative joint disease of the spine, you have spinal arthritis, degenerative disc disease. I like to use either heat or a combination of heat and ice. And what I like to do is when it's a chronic condition like this, I like to end with heat. Okay, so it's a long-term problem. I like to end with heat. So we might start with heat on the tissues. So let's say it's lower back, so we place a heating pad there. Safely place it, wrap it appropriately, make sure you don't burn yourself for 10 minutes. Then put an ice pack, of course, wrapped in a towel. Do not put it directly on the skin. Do not burn yourself for another 10 minutes. And then you follow up for the last 10 minutes with a heating pad. So this alternating heat and ice, what it does is it creates this pump. So the ice constricts your blood vessels. When you put ice on your hand or on an arm, it makes it you'll see that you'll lose a lot of the color will change. It will become lighter because you're driving the blood from the area. If you use heat, it brings blood to the area and it can be more red. So what you're doing is you're actually, with alternating the heat and ice, you're creating a vasoconstrictive and dilating pump. You're using the body's blood vessels to drive out inflammatory chemistry that's local by constricting the vessels, which drives the blood away from the area. Then you're using heat on the area to dilate the vessels to bring blood, nutrients, and oxygen back to the tissues. And you're kind of flushing out inflammatory chemistry this way, right? So use heat first, bring in blood and nutrients really to the area. Use ice on it, flushes that out. Bring heat again, brings in new blood, nutrients, and oxygen to help you heal. That can be a very effective strategy at helping you to decrease some pain while you're at home if you have arthritis. Now, if you have arthritis of like your hands, one of the best things that we've seen people use are paraffin wax. And if you have had, manicures, you may have had this done, but you can dip your hands in this wax, this really warm wax, and they'll put basically a glove over your hands, and it just holds that heat in. Really helps to deep heat the joints of the hands and bring more blood to the tissues and relax the joints, and it can really help with arthritis of the hands. Now, if you're dealing with these problems, guys, the main thing to understand is, some people will have arthritis and have absolutely no pain, because arthritis, the change in the bone, doesn't cause pain. It's inflammation that creates the pain. So a lot of people have these degenerative problems that are causing an inflammatory process locally because they're compressing tissues and they're they're actually causing tissue destruction. Other people have really inflammatory chemistry, so their diets are horrible. They have nutritional deficiencies. There's a lot of different things that we can utilize that are anti-inflammatory approaches, not only from a dietary perspective, but from a temporary nutritional supplementation perspective to help decrease pain. So if you're dealing with these issues, you might want to consider, just getting my opinion on your case. I'd be happy to take a look at you and let you know what I think. If I think that we could help you with some therapeutic approaches, or with a therapeutic approach, or with a dietary and temporary nutritional supplementation approach. If you're interested in that, just give us a call. Our phone number is 828-324-0800. You can also learn more about my practice at hickoryspine.com. I hope this has helped you to better understand some of the home therapies that you could utilize for arthritis. If you have any questions or anything, just let us know. Thanks.